Good afternoon. Oh, we could do better than that. Good afternoon. How's everybody feeling today? Nice. I love that energy. Let's keep it up. Thank you all so much for being here with us. Oops, I hope everyone can hear me okay. It might be my hair. Let's see. Okay, well, that intro definitely made me sound way cooler than I actually am. But it is great to be here with you all. My name is Michelle Jalali. I use she, her pronouns. I sit on the board for the Ehlers-Danlos Society. And as mentioned, I also work for the Portland Trailblazers. So I'm all the way on the West Coast, but happy to be out here on the East Coast for a little bit. And outside of this work, I am a trauma-informed diversity, equity, and inclusion consultant. And this is such a cool conversation that we're about to have, and you all are in for an extreme treat. We have activists, we have authors, we have executive directors, we have business owners, we have advocates sitting on this panel, so let's give it up for them before we even get started. Yes! Now I want to give them the chance to really speak a little bit about themselves as we get started, so we will start kind of going down. And I'd love to hear if each of you could share your background and connection to EDS and HSD, as well as how your personal experiences have shaped your perspectives on equitable care.
Indeed. Well, hello everyone. Can you hear me okay? Yes. Great. We have a backup mic, but hopefully these will work. So as you know, I'm the CEO of the Ehlers-Danlos Society, but I also live with Ehlers-Danlos syndrome, and I was diagnosed when I was 24 after a 13-year diagnostic odyssey. And I also happen to be gay, and I think that has also added challenges along the way, especially when it came to my diagnosis, going through that through my teens, just added another barrier. So I'm delighted to be on this stage to talk more about that, because I think it's very important to understand how these challenges make it even harder.
Thank you.
My name is Mars Lombardi. I use they, them pronouns. I am trans non-binary, and my EDS journey was a very long one, about 20 years from the time that I was symptomatic until I was diagnosed. And since then, I have had many other diagnoses, as many of you, I'm sure, are familiar with. And I think that, so my connection has really grown with EDS and HSD through the Ehlers-Danlos Society in particular. I've just become more active, speaking at events and participating in the conversations behind the scenes, trying to identify research initiatives and really make sure that the needs of patients are being clearly identified and advocated for. And with respect to marginalization, I think just being a very complex patient, being trans, have all really contributed to the gaslighting and the constant explaining of things that I have to do to be able to get any kind of validation. And these are just a fraction of the things that other people who are multiply marginalized go through as well. So I'm looking forward to having a really good conversation today about what we can do to try to change things through our own conversations.
Hi, can you hear me? Yeah? Okay, cool. My name is Danny Medina. I have vascular Ehlers-Danlos syndrome. I am happily married to my wife, pretty new. I was diagnosed at 22. I grew up in a very minority-majority community, high crime rate, low income, and the clinic that I went to was actually raided by the DEA shortly after I was diagnosed, so there were not a ton of resources growing up for what I had and the symptoms that I was presenting, and those two coming together, disability and being brown in a very low-income community, definitely put my life more at risk, not getting diagnosed until I had internal bleeding. So that's why I think this conversation is super important to hopefully lead to earlier diagnoses.
Hi, everybody. Hello. My name is Sabra Thomas. I have hypermobile Ehlers-Danlos syndrome. I was diagnosed with Ehlers-Danlos when I was 12 years old, which people always say I'm lucky because I was diagnosed at a younger age. I am a patient advocate, as that was described, and I not only advocate for myself, but other people, particularly people of color who might not feel as though they have a voice or they're going to be believed. I like to advocate mostly through social media. That's where I get like my target demographic, if you will. But I like to validate people's feelings because even after my diagnosis at 12, I still had doctors questioning me whether or not that was really it. Am I sure? Who diagnosed it? You know, start with the gaslighting and questioning my existence, almost like, you know, so that I like now that I'm 36, that I feel a bit stronger in my diagnosis, stronger in myself, stronger with advocacy for others like me. And I'm so grateful to the Ehlers-Danlos Society to allow this platform to have a rather candid conversation. Usually this sort of conversation either doesn't happen or it happens in a very small, isolated circle. So I'm very grateful that we all have this platform to talk about our different experiences.
Hi everyone, my name is Dr. Akilah Cadet. My pronouns are bad bitch. So, with that said, I am single, so, you know, send them my way. I'm a heterosexual cisgendered woman. My pronouns are she, her. I was diagnosed with myopathic Ehlers-Danlos syndrome. So myopathic is less than 1 million folks have that. So that means I'm extra AF too with my EDS. I was diagnosed May 2021, so very fitting to be diagnosed during our month and where we celebrate Ehlers-Danlos syndrome. By 2023, I was the keynote speaker for this conference, and also in 2023, I became a board member for the Ehlers-Danlos Society. So as soon as I was diagnosed, I knew I could use the activism I do in other spaces and workspaces and places to talk about Ehlers-Danlos syndrome. And then this year, 2024, I have a book that's out with a top 5 publisher called White Supremacy is All Around, Notes from a Black Disabled Woman in a White World, where I actually talk about Black pain, I talk about my EDS journey, and I'm proud to really be a disability advocate as well as advocating for people of color, primarily Black women, who are usually left out of the equation when we talk about Ehlers-Danlos syndrome. Before I pass it back to Michelle, it's important that you note that we all shared parts of our intersectionality. And for those of you who don't know, intersectionality means the intersections of our identity. It was a term coined by Kimberly Crenshaw in 1989. So if you think about a bus going down the street and the first intersection is women have to get on the bus. If the next intersection is people from the LGBTQ+ community, they would get off. Disabled, they would get off. So eventually at the end of that street where that bus goes, you'd have heterosexual, cisgendered, non-disabled white guys who have the most power and privilege, and everyone else is forgotten. So intersectionality is why we're here, and you can see that visually with our visible, invisible, and dynamic disability.
Let's give it up for this incredible group of panelists that we have here. So, Sabra, we're going to start off with you. What do you believe are some of the most significant barriers that marginalized communities face in accessing equitable care for EDS and HSD?
Oh, yeah, Michelle, I think there's a couple of things, honestly. I think a big barrier is what I would call medical deserts, primarily seen in urban or primarily people of color populations. A medical desert is, you know, if you can't access easily, quickly, a doctor, a clinic, urgent care offices even. So just from the start, you know, you're already disadvantaged with that not being necessarily available to you, right? And then something else too that I feel is a barrier is, okay, even if you do have all the doctor's offices in the world by you and you're able to get to them, right? Then there's insurance issues. There's income issues, you know, because not everything, unfortunately, I think we could all relate to this, not everything that we need as far as treatment is even covered by insurance, even if you have the top-notch insurance, but let's be real, most of us do not have that top-notch insurance because we cannot afford it. So then when you're talking about being a person of color who's coming from a low income, you know, they might say you're only able to go to this doctor, this office, this facility, you're limited. I can only speak as a Black woman in the United States. I'm sure, or well, I'd like to hope that it's different in different countries better, I hope. But that is, I think, a medical barrier. And then even aside, let's just say, in a perfect world, you have a hospital right across the street from you, you have the best insurance in the world, then you still have some healthcare professionals who might not believe even what you're saying about your pain, about your symptoms. What stands out to me, like I said, I was diagnosed when I was 12 in 2001. And I recall in 2019 going to a doctor and them questioning my Ehlers-Danlos because, and I'm quoting him, he said, Ehlers-Danlos is only found in European women. So am I sure? Who diagnosed me? Then he started questioning. Then he started questioning. Who diagnosed me? Where did I go? Was I sure? Because again, he was just so certain that only, if I can speak candidly, only white women or European women had Ehlers-Danlos. He had never seen or heard of a person of color, much less a Black woman, being diagnosed with this condition. And that was 18 years after I was diagnosed, and I've been living with this my entire life. But what do I know, right? I'm just, following this guy who my top-notch insurance told me to go see. So I think there's so much work to be done within the healthcare. Thank you. And see, this is a barrier. But no, in all seriousness, I think there's so much work to be done within the healthcare community, and I thank each and every healthcare professional that's here. I hope you're listening to what not only I say, but what these wonderful folks on stage are saying as well, and validate our concerns and issues.
Thank you so much. Let's give it up. Now, you spoke a little bit about the nuance of healthcare practitioners not even knowing something was possible. Now, Dr. Cadet, you speak in your book about Black pain and the experiences of potentially having to educate practitioners that pain is real in people of color, women of color, specifically Black women. So my question for you is, what are some initiatives that have been effective in addressing healthcare disparities for those with EDS and HSD in marginalized communities? And what role do advocacy and education play in creating more equitable care for those patients?
Yeah, the best initiative is believing Black women.
Yes.
That's it. If you can believe a white person, you can believe a Black person. If you can believe a man, you can believe a woman. And that's all that needs to be done. The initiatives for US, there aren't any. There's so much data right now. For example, something that's very easy, very non-biased, very not rare is anyone who's birthing, a Black woman who's able to birth, or person who is a birthing person who's able to birth, they in US have 3 to 4 times the rate of mortality for themselves or baby. We've been talking about this for 20 years and nothing has changed. Right? And so it's not about initiatives, it's about our attitudes, our behaviors, and our beliefs with how we listen to each other, how we take care of each other, and how we advocate for one another.
Beautiful. Yes. Now, I'm going to kind of switch gears a little bit and pass it back over to Laura, apply some pressure here, if that's okay with everyone. So, we talk a lot about advocacy and listening to each other and caring about each other. How can patients and advocacy groups work more effectively with healthcare providers to ensure better understanding and management of EDS and HSD?
Well, I think, what Akilah just said is listening. And what I said in my talk earlier, I think there's so much that needs to be done. And that so much is going to cost time and money, but listening doesn't. And that is exactly what I said when I opened this up. And I think that if I was listened to properly and heard when I was 16, I wouldn't have had to wait till I was 24 to get those answers. And it didn't need for them to know about what EDS was. They just needed to listen to the fact that, I didn't just have a couple of things going on and that made me unlucky. It's a multi-systemic condition that needs to be looked at together. And I think doctors are taught to look in silos, to hear hoofbeats, think horses, not zebras. And that's what needs to change for me. And it's the role of the patient organizations and us as individuals to help that change happen. And we can see through ECHO, and we can see through the work we're doing, we can see through the people in the room, that we are reaching people who are so keen and willing to help and to listen. But my God, it's a minority. And I think for me that the two biggest things that are missing out of the education of future healthcare providers are, of course, because I look through this lens every day, Ehlers-Danlos syndromes and hypermobility spectrum disorders. I think if we're lucky, it's a few lines, it's a paragraph. It's not nearly enough. But also the importance of bringing in lived experience. And a resolution was just passed at the World Health Assembly about the importance of social participation leading to universal health coverage. And I think all of our experiences would have been so much easier if our lived experience was heard and seen and understood. And the reality is we still live in a world, and not just the US and the UK, in a world where geography, wealth, gender, race, sexuality determine your quality of life. There is nowhere that's got that right. People always ask me, is it better in the UK? No. People in the UK know I travel to the US a lot. Is it better there? It's possibly worse here. And so there's nowhere that has got that magic sauce. And I think as an organization, that's what we're trying to do. I speak all over the world on panels and at talks about lived experience, about EDS, about HSD, and the needle is moving. It's getting better. But until this is a chapter, a whole section, a whole, folder in the medical education system, then it's not really going to shift the future of healthcare. But the biggest challenge we have on our hands is not how to educate people, it's how to re-educate people. Because there are far too many people out there who think they know what EDS is, who think they know what it is to live with these conditions. Oh, you're just a bit bendy. Oh, it's just, you'll grow out of it. I remember very clearly being 17 years old and being told that if I was a dog, they'd put me down. That's a true story. And I just sat in this room and thought, maybe they're right, Is it because I fancy girls and not boys? Is that what's going on? That that's stressing me out so much, it's making my body hurt? Because that's the narrative they give you. That's what they make you think. That it's your trauma of being different that presents itself physically. And that has to stop. And that I'm so proud to be the CEO of this organization so that people can see that a gay person can be a CEO and can be someone living with this condition. Because I didn't have that growing up. So I think it's so important that we stand up. I'm so proud of the people we have on our board that are helping us diversify that voice, teaching us and allowing us to grow and get better. And I turn to all of you to help us get better and to keep telling the stories of everyone and not just a few. So that's what we can do better.
Beautiful. Thank you, Laura.
Thank you.
Thank you. Give it up for Laura. Now, I think this is a great segue. Mars, I really want to hear from you because we had conversations about the importance of really amplifying representation in different spaces, and this kind of speaks to what Laura just spoke to. And why is representation of marginalized voices within the medical community and patient advocacy groups crucial for advancing equitable care?
So I think my answer is very simple. You can't expect change to happen if you don't have all of the stakeholders involved. And EDS and HSD really have a very wide and diverse population that they affect. So if we're only bringing to the table a fraction of our community to make decisions, to document experiences, to advance research, to address concerns, then that's all we're getting. We're getting a fraction of the progress. So for me, it's very simple math, but it's not that simple in practice as we see. And right now, we're a very small number of people on this stage, but we are all incredibly diverse in terms of the demographics that we represent. But that's the key. We all need to be here, and every one of our voices needs to be heard. We need to tell our stories. We need to tell them again. We need to tell them as many times as they need to be heard to as many audiences as possible, because we need everybody in this community to know that their voice matters and that their experience matters. We need to know that people in rural communities like the one that I grew up in, we need to figure out how to make healthcare accessible there. We need to figure out how to change things so that I am not constantly being misgendered and my pronouns are constantly not being used because other people don't understand them or don't want to understand them, or they're just focused on the sex that I was assumed to be at birth. And these are things that take time and they take a lot of work, but you all are the people to do it. It's us, it's our community, and we take care of us. So we need to get out there. You need to bring these conversations back into your community. Some of you may already be having those conversations, and if you're not, there are a lot of resources. Any one of us up here is probably happy to have a conversation with you about how you start to have those conversations with your communities, and hopefully in time that will lead to change.
Beautiful, thank you. Now, Dr. Cadet did a great job of prefacing this conversation a little bit around the importance of it really coming from an intersectional lens when we talk about equitable healthcare. And so, Danny, I'm going to throw it over to you and really want to hear from you about how you see the concept of intersectionality playing a role in addressing the unique challenges faced by individuals with EDS and HSD.
Yeah, I think that a huge reason why I didn't get diagnosed in the first place is because a lot of the reference photos for vascular Ehlers-Danlos syndrome show the translucent skin. I am pretty brown, so a lot of the areas on my body that don't have melanin are like my breasts and the soles of my feet and the palms of my hands. So I remember going to a doctor and telling him that I was diagnosed with embeds. He's like, Are you sure? I was like, I carry my genetic results because I hear it all the time. And I'm like, I'm sure, do you want to see? He's like, no, it's like, I haven't seen it in somebody of your background before. And I'm like, do you want to see my boobs or something? Like, I'll show you. So I believe like, because of the way somebody looks and what doctors and professionals are being taught, they're not putting those two things together. They see a brown girl with a cane walk in and they're like, are we sure that's what's going on? Are you sure that's what's going on? I'm pretty sure. But a lot of it is what doctors are being shown is just a lot of the references are people who are lighter skinned, and I think if they see the person for each identity that they identify with, because like I'm queer, and even at the doctors, they're like, oh, like, are you and your husband planning to get pregnant? And me and my wife cannot get pregnant naturally that way. But they don't see all of my identities. They see the one that they can see straight forward, which is I'm a woman and I'm brown. So I think if they see each part of a person, it'd be way more, I don't want to say accessible, but accessible to go to a doctor and feel comfortable that you're being seen for what you are.
Yeah, beautiful. Thank you so much for sharing that. Let's give it up. Now, we started to have this conversation today kind of in hopes that we will continue these conversations outside of this space, right? We want to empower you all to continue talking about the hard stuff sometimes, the confusing stuff sometimes in your own circles. For me, I always kind of make this joke, like one of the first conversations that I had with my parents, older Asian and Jamaican parents, was around like what it meant for me to advocate for myself when I went to the gynecologist. And my dad was like, I don't want to hear this. And my mom was like, what are you talking about? Like, blah, blah, blah. Because she always had practitioners that she knew and grew up with, et cetera. And I was like, no, this is real. Like, these are the conversations that we need to normalize and have so that we understand that equity in healthcare is a priority for all of us to be successful and to have, thank you very much, and to have safety when it comes to engaging in our own health. And so the question that I have for you all as we wrap up is reflecting on kind of this discussion that we had. What message would you like to leave with the audience about the importance of empowering marginalized voices in the EDS and HSD communities? Or what's one key action that you believe everyone could take today to contribute to a more equitable care for patients in marginalized communities?
Oh, it's a tough one. I think one thing that is really important within our community that we can do is remember that every one of us is different. And every one of our story is valid and true, and it may be very different to the person next to you. And that doesn't make it not true. And I think that you see so much fragmentation amongst our own community. I think it's really important that at least to each other we can be kind, and we can be acceptance of difference and people's experiences. And I think that that is something I would really, really wish for. And I think, everything we're doing at the society is to try and get to a point of equitable healthcare. And I think we're all talking here from a place of the UK and the US. I think if our friend in Ethiopia right now could sit up on stage, that would be an entirely different story. And that's what we're trying to work hard on, to try and find out what those stories are. So I think everyone should stand up and share their stories, because you never know how your story is helping another person and making them see a reflection of themselves in you. And I think that's really important.
Thanks, Laura. Yes.
I think in following what Lara just said, in having these conversations, we are also different. And we had a meetup this morning to just kind of prep for this panel. And when we were talking about the topics that we wanted to address individually during this time, one of the things that I said was, I want to take a step back, because there are people of color on this panel, and I don't think that I should have first dibs on this conversation topic. And I know that I'm trans, I'm disabled, I'm chronically ill, I have rare diseases, I'm multiply marginalized, I recognize that, but I also recognize my own privilege. And if we can all sort of recognize when it's our time to shine, and when it's also time to take a step back and to lift up the voices of other people, that is how we begin to start to make change and to de-marginalize people who are still quite marginalized. Thanks.
I think just listen to people. I don't think it should matter that I'm brown, that they're trans, that she's black. You should already just be listening to people when they say that they're in pain, when this hurts. Just point blank, listen to people. We shouldn't just be assuming that they're faking it, because 80% of the time they're not, and who would want to live like that if that were the case? Just listen to people, listen to your friends.
Mike? Okay. I would echo, EDS echo. I'm sorry, my puns are cool. I would echo almost everything that everyone has said thus far. In the great words of Aaron Burr from the musical Hamilton, talk less, smile more. In all seriousness though, listen to I will speak from the Black woman perspective, listen to the Black friend, Black coworker who might be expressing, pains, concerns, thoughts, and a lot of times when I'm speaking and sharing my experience, which it's gotten better in the years. Before, I used to just barely talk about any of this. But a lot of times when I was speaking, it was always cut off by, oh, I know what you mean, because blah, 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 blah. okay, maybe you do, but like this is a very, like Mars said, this is not my time to shine, but I'm sharing my experience. And sometimes people think that they're being empathetic by saying, oh, I know what you're feeling, or I know what you're thinking, but sometimes that can also come across as dismissive, to the person who's expressing that. Because I don't know about you all, it takes a lot for me to talk about my medical needs. And when I'm feeling comfortable enough to speak to a person like that, I just would rather you just kind of sit, listen, take it in. Maybe regarding social media, like I said, that's mainly where I am. You could share a person of color's post without saying, like you don't have to say anything. You could just share it. Let their voice be the voice. And I think that would really help a lot of us feel validated in what we're going through.
Marginalized means insignificant. They are not insignificant, she's not insignificant, and neither am I. So I would encourage you all to remove that from your terminology, from your language, because words are powerful. Marginalized, in addition to being insignificant, it means peripheral. We're right here. You can see us. So people are historically excluded. People are purposely ignored, but we're not marginalized. And once people realize that we are actual human beings, then we can have real conversations where we can talk about the care and not getting to these conversations about equity. It is 2024. So it is time that we are valued in a way by starting with the power of our words. And fuck is a real word, so you're welcome.
And on that note around language, these panelists really are incredible. I have learned so much from each of you in a short period of time. And I just want to thank you for coming up here and being vulnerable and transparent and brave in having these conversations, but also in giving ourselves permission to continue to have these conversations. We hope that it continues to encourage you all to have them in your own circles as well. So on that note, let's give it up for our fabulous panelists. Thank you so much.
Thank you.